Hospitals are places of healing, but they are also places where we confront the fragility of life. Within their walls lie specialized units dedicated to patients facing the most serious illnesses and injuries, the intensive care units, or ICUs. These units are a whirlwind of advanced technology and skilled medical professionals working tirelessly to stabilize and treat those whose lives hang in the balance. Critical illness encompasses a spectrum of conditions from severe infections and organ failure to traumatic injuries, each posing a significant threat to a person's survival. The atmosphere within an ICU is often a mixture of hope and anxiety. The constant hum of machines, the hurried footsteps of doctors and nurses, and the subdued lighting create a surreal environment for patients and families alike. Here, time seems to both stand still and race forward, marked by the regular beeping of monitors and the anticipation of the next medical update. It is in this intense setting that difficult decisions about life-sustaining treatments and end-of-life care are often made. The primary goal of intensive care is to stabilize critically ill patients and support their vital functions. A team of specialists, including critical care physicians, nurses, respiratory therapists, and pharmacists, work together to provide round-the-clock monitoring and interventions. Treatment approaches vary depending on the underlying illness or injury, but often involve advanced medical technology and procedures. Mechanical ventilation assists breathing, while dialysis supports failing kidneys. Medications manage pain, fight infections, and regulate blood pressure. The path within the ICU is often unpredictable. Some patients respond well to treatment and gradually recover, while others experience setbacks or complications. For some, the ICU provides a bridge to recovery, while for others it becomes a place to transition from aggressive treatment to a focus on comfort and quality of life. As medical professionals navigate the complexities of critical illness, they must also recognize when aggressive interventions may no longer be beneficial and when a shift to palliative care is appropriate. Palliative care is a specialized medical approach that focuses on relieving suffering and improving the quality of life for patients facing serious illnesses. Unlike curative care, which aims to cure the underlying disease, palliative care seeks to address the physical, emotional, and spiritual needs of both patients and their families. It is not limited to end-of-life care and can be provided alongside curative treatments at any stage of an illness. Palliative care teams consist of physicians, nurses, social workers, chaplains, and other healthcare professionals who work together to provide comprehensive support. They focus on managing pain and other distressing symptoms such as nausea, fatigue, and shortness of breath. They also provide emotional and spiritual support to patients and their families, helping them cope with the challenges of serious illness. Palliative care recognizes that quality of life is paramount and that sometimes the most compassionate approach involves shifting the focus from prolonging life to ensuring comfort and dignity. Section 4. Finding Peace, Hospice, and the End of Life's Journey. Hospice care is, well, a specialized form of palliative care provided to patients who are nearing the end of life, typically when their life expectancy is 6 months or less. It focuses on providing comfort and support not just to patients, but also to their families during the dying process. Hospice care can be delivered in a variety of settings, including patients' homes, hospitals, and dedicated hospice facilities. Unlike curative care, which often involves frequent hospital visits and aggressive interventions, hospice care prioritizes comfort and quality of life. Pain and symptom management are, of course, at the forefront, and medications are carefully adjusted to ensure the patient's comfort, even if it means foregoing treatments that might prolong life but diminish its quality. Hospice teams also provide emotional and spiritual support to both patients and their families, helping them navigate the complex emotions that arise during the dying process. Section 5. Difficult decisions, ethical dilemmas at life's border. Critical illness and end-of-life care often present profound ethical dilemmas. Decisions about life-sustaining treatments such as mechanical ventilation, dialysis, and cardiopulmonary resuscitation or CPR can be agonizing for patients, families, and healthcare providers alike. When the potential benefits of these interventions are uncertain or outweighed by the potential burdens, well, difficult choices must be made. Advanced directives, such as living wills and durable powers of attorney for healthcare, allow individuals to express their wishes regarding medical treatment in the event they become unable to communicate their decisions. These documents can provide valuable guidance to families and healthcare providers when making these incredibly tough decisions about end-of-life care. Open and honest communication among patients, families, and healthcare providers is absolutely crucial to ensure that treatment decisions align with the patient's values and goals. Section 6. A family's embrace. Navigating grief and finding support. Families of critically ill and dying patients face an incredibly challenging and emotional journey. The stress of witnessing a loved one's suffering, combined with the uncertainty of the situation, can really take a heavy toll. Hospitals recognize the vital role that families play in the care of their loved ones and strive to provide them with the support they need during this difficult time. Social workers, chaplains, and other support staff are available to provide emotional support, counseling, and guidance to families as they navigate the complexities of critical illness and end-of-life care. Support groups and educational resources can also help families cope with the emotional and logistical challenges they face. Hospitals understand that supporting families is an integral part of providing compassionate and patient-centered care. Section 7. A tapestry of compassion, the multidisciplinary approach to end-of-life care. Hospitals approach end-of-life care with a multidisciplinary and compassionate approach, recognizing that each patient and family has unique needs and preferences. Teams of doctors, nurses, social workers, chaplains, and other healthcare professionals work together to provide comprehensive care that addresses the physical, emotional, and spiritual needs of both patients and their families. Communication is absolutely paramount in end-of-life care, and hospitals strive to create an environment where open and honest conversations can occur between patients, families, and healthcare providers. Care plans are tailored to each patient's individual needs and goals, ensuring that their values and wishes are respected. The ultimate goal is to provide compassionate and supportive care that honors the dignity of each patient as they approach the end of their life's journey.